Hi, Dr. Minkoff here. I want to take up a term called CRP, and you may have heard of this. If you haven't, I'll just give you a little bit of information on it today. CRP stands for C-reactive protein. This is a protein that the body makes in response to inflammation, or it's actually it's when it's inflamed, these things are released. Probably part of the process of causing inflammation is these particles too. Now, if your doctor isn't ordering on you what's called a high sensitivity, that's what HS is, CRP, on your annual visit, you should ask them to do it. This is a particle when it's elevated is a risk factor for cardiovascular disease. So that could be stroke, it could be heart attack, and if you're walking around with an elevated CRP, you'd want to know it. A lot of people who have heart attacks or heart disease don't know, or their doctors aren't looking for things that precede the heart attack so that they know there's actually inflammation going on in that person's body. Now, in my experience, when I see a high CRP, I know that the inflammation is coming from one or two places, usually in an asymptomatic person. So this person's walking around, they don't have sore joints, they're not in pain, but they have a high CRP. Now, really good is below 1. Acceptable, moderate is probably up to 3. I saw somebody earlier, about 6 months ago, who was at 24. So it was really high, and that's a big risk factor. So when I see this, I think of two things. They've either got infected areas in their mouth, that might be gum disease or root canal teeth, or what are called cavitations, their area in their jawbones where there's actually infection, or they have bad bacteria or parasites or fungus growing in their intestine, and it's causing inflammation within their gut. Now, we have bacteria in our gut which are friendly ones, and they don't produce inflammation locally. But there are also bad ones, and the bad ones cause inflammation in the lining of the small or large intestine, and they produce biotoxins which leak into our bodies, and they cause inflammation too. So if I see someone with a high CRP, I will do a comprehensive stool test on them. If they have bad bacteria, we will treat it. If they have overgrowth of yeast, we will treat it with natural methods. If they have parasites, we will treat them. If they have root canal teeth or gum disease, I will send them to a biological dentist so that they can get their teeth straightened out. And lo and behold, when we do this, within 3 to 6 months, the CRP will come right down into range. 0.6, 0.8, 1, and that risk factor of future heart attack or future stroke is not there anymore. And I consider that really good medicine, because that's what the doctor should be doing, is finding things in your body before the catastrophe. You know that half the people get diagnosed with heart disease when they have their first fatal heart attack? Now that's pretty scary. You went to your doctor, he listened to your chest, you got an EKG done, and he said you were fine. He didn't look at your CRP or your homocysteine, another risk factor, or your fasting insulin. There's a whole bunch of these, and we'll do a talk on those pretty soon. And so he doesn't know that you have high inflammation or high risk factors going on behind the scenes. And next thing you know, you have a heart attack and you died, and that was your first symptom. So we want to prevent this, and good medicine is preventive medicine. It's finding out what's wrong with you before you're actually ill, so that you can put the little correction in. And if you put the correction in, you can be healthy and you can live a long time. Okay? So that's what CRP is. Make sure you get your doctor to order one for you. If it's high, now you know what the problem is. You may need to see the dentist. You may need to see a nutritionist or naturopath or chiropractor or doctor who, like me, who knows about gut and gut problems to get the help that you need. Your CRP will go down and it will go away. And the wrong thing to do is take aspirin, take blockers, take things like that because they're not addressing the underlying problem. They're just making it worse. Okay? Hope this helps. Talk to you soon.